for joining me. You must be exhausted with everything going on at the Benefits Pro Broker Expo.
Oh, it's definitely been one very long day, but it's definitely worth it. Just all the information here, all the people here sharing ideas. It is worth every tiring minute.
Oh, good. When you guys don't just do the expo, you've got a lot of activity that goes on throughout the year. Well, before we even get there, why don't you tell me what brought you to healthcare? How did you get into this?
Well, Benefits Pro, I am the managing editor with Benefits Pro magazine. We are a magazine, we are a website, newsletters, and an event, of course. And it's more than just healthcare, it's the entire benefits package, but of course healthcare is the big part of that. And so my background is actually in publishing. I have been working for B2B, business-to-business magazines for over a decade now. And I actually started working for a fitness publication. And that's how I found that I really was interested in making people healthier. And from there, I've just kind of gravitated. I ended up at Benefits Pro about 4.5 years ago. And it was just kind of an extension of finding new ways to help change the healthcare industry, help people live healthier lives. And it's been 4 years of learning, and I still don't understand everything in the healthcare industry, so I know how frustrating it is for everyone else out there, but we're doing our best to make it better.
Yeah, that's awesome. And for an industry that many say sometimes is slow moving, there's just so much new information coming out every day. And I know you guys recently, I think just in the past several months, kind of posed some questions to your audience about the state of healthcare, and that's what you're going to talk to us about today. Mm-hmm. So what did you learn about that?
Well, we are aggregators of information. In addition to putting out our own surveys, we are also covering all of the information coming out of the industry through corporation, or like RAND Corporation is a big one. The information coming out of the Centers for Medicaid and Medicare. There's just so much information out there, and so we are doing our best to sift through all of that on behalf of the benefits brokers, healthcare stakeholders, sift through that and to see what the trends are, what the key pieces of information are that they need to be knowing. And I think right now the one that scares me the most is just how much strain the healthcare system is under. We all have been hearing about burnout and stress in the healthcare industry. A significant number of doctors, nurses, even just your basic hospital staff are looking at leaving the profession.
Yeah.
They have had a really rough couple of years. Can't really blame them. But what that's doing, it's doing a couple of things. One, it's driving up the cost of labor in the healthcare industry. I think one stat said something like a 33% increase in labor costs for healthcare systems. And actually Madison, Wisconsin, my hometown Madison, Wisconsin, I just saw a stat that one of their health systems is offering a $100 an hour bonus to nurses to pick up extra shift. $100 an hour. And so that's where the costs are coming from. But also, if they can't get people to staff hospitals, health systems, people aren't going to get care. That's where you're going to see the rural hospitals shutting down. Rural hospitals have always been operating right on the edge of profit margins. So we're going to see the cost of care go way up. We're also going to see the availability of care. It's going to be just much more difficult. Also, adding to the cost of care is supply chain issues. I'm sure we all love hearing about supply chain issues, but there's been saline shortages. I just saw an article this morning about a drug manufacturer closing down their plant, and that's going to lead to drug shortages down the road. It's been a really rough couple of years for the healthcare industry, and while the pandemic may be over,
Yeah.
it's going to take a while before the real extent of the damage.
I agree. And the pandemic's turned into an endemic, and then you think about it even from the retail side, I just keep looking at these formula shortages, and what is that going to turn into if we can't get these babies fed? I mean, it's terrifying. And I think, I'm hearing a lot about travel nurses versus staff nurses, and it's crazy just how expensive things are getting. So let me ask you this. Do we see a sign of improvement, or are we still kind of riding it out on the provider side right now?
I think it's going to get worse before it gets better, because you can't just go out and hire new doctors and bring people into the industry. You have to get people trained and educated to become doctors, to become nurses. You can't just bring people in. And we talk about healthcare is slow to change, very slow, and I don't think it will be able to change as fast as it needs to. I mean, there's definitely solutions that we can use to get around the problems we're having. Virtual healthcare is a big one, obviously. Being able to talk to a doctor online. So maybe the rural hospital is closed, but maybe you can call up a doctor on the other side of the state. So there are going to be solutions like that that we need to adopt more quickly if we really want to get ahead of this.
Yeah. And then I think you also had some information about the consumer side and how the strain is being expressed on that end. What can you talk to us about that?
Oh, so the healthcare consumer, that's a good question. And
well, I think you were saying some things about the delayed care because of the pandemic.
Yes. Thank you. Good one. Yes. Well, during the pandemic, we all maybe put off going to the doctor because we didn't want to go be exposed, sit in a waiting room with other sick people. And there was honestly just a lot of, economic uncertainty that maybe you didn't know if you were going to have a job in a month. So maybe you put off all your health care because, you wanted to save up, have that rainy day fund. You didn't want to spend money on unnecessary health care, even if it's in the long run you may end up spending more because people have or during the pandemic people were putting off health screenings that might have detected cancer, might have detected heart disease, things like that are just going to become more expensive the longer they go undetected. So there is that aspect.
I actually was speaking to someone today, and they were talking about some dental companies that are sending hygienists to your house to at least do the cleaning, and then they have some high-tech something where they're taking pictures of the inside of the mouth on mobile devices so that the dentist can look at them, because that has seemed to be the last health care that people are willing to do, which I don't blame them. You're laying in a chair with your mouth open and someone's face in your face. That seems pretty risky at the height of a pandemic. But I was fascinated by that they've come with these other solutions, that the hygienist can go into the house, do the cleaning, which is really the most important part of the regular dental checkups, and then have those cameras to do other items.
And those are those solutions that we need to be adopting and putting into play as quickly as possible so that we can prevent people from, putting off all their dental cleaning. And I mean, dental cleaning is about more than just cavities, because you can detect heart disease through the So even that is, you don't think of it as a preventive care or screening effort, but it definitely is.
Yeah, and then I think we were also talking a little bit about mental health throughout the pandemic and how that's affected the consumer.
Yes, mental health, huge demand now when we talk about a shortage of healthcare providers. Mental health had a problem even before the pandemic, and now that is getting much worse. People struggled during that pandemic. We all were lonely. We lost the daily routines. We felt lost. We didn't know who we were anymore. So there has been definitely an increase in substance abuse, alcohol, drug abuse, all of these unhealthy coping mechanisms that people developed during the pandemic. So there's definitely an increase in that. We're seeing that again on the digital health side. We're seeing mental health apps. We're seeing virtual healthcare providers. Again, it might be too slow to catch on and really stem the tide when we need it, but it's there. We're working on it.
Yeah, I've seen that too, and I've seen a lot of these apps and services starting to be covered by insurance, which has been a huge thing, so that rather than having to pay out of pocket, or worse yet, not be able to afford to pay out of pocket, you can use it as part of the benefit you get. So that's been something that we've kind of noticed as we've been looking at these things.
And that's something we talk about, especially when we talk about the broker and the employer-sponsored benefits plan side, is rewriting the plan to include these things. I mean, that's where the slowdown really is. Everything on the administrative side, it's like the services are out there. We have to get it to the consumer. We have to pay for it. We have to write it into the healthcare plan. How it's going to be covered, how it's going to be reimbursed. And that takes time.
Yeah. Well, so we're at the expo right now. So upstairs from us is a huge room of all sorts of vendors, well included. And one of the things I'm seeing is a lot of these offerings, at least in current state, I think in an effort to get it to market faster, either don't accept or don't require or have an alternative method to insurance. And that's something that WELL can really kind of help with as our marketplace. We've got the traditional insurance, we're working with the ICRA, but I see all these other quote unquote add-ons, for lack of a better term, that you can reference someone to, like, okay, so this is what's covered, here's what's not, are there other options? So I think that there's some innovators, especially in the digital space and the consumer space, that are looking to get those tools out to the consumers and out to the brokers to help with these effects of the pandemic. And the pandemic, I think at this point, is more of an endemic. As I said, I don't think it's going away, but we're living our lives. So now how do we catch up on all those other things, like you were saying?
And you talk about the brokers. If you go upstairs, if you ask any of the brokers, they'll tell you that they are they're really innovating and trying to put together plans that are not just insurance. They're trying to build these strategies into a holistic offering for employers. Brokers increasingly are seeing themselves as consultants, advisors, partners to the employer, where they're not just selling an insurance product. They are putting together a wellness plan, that's including these apps, services like direct primary care, any kind of virtual telehealth products. They're trying to create something that can help the employer help their employees with their healthcare and make it consumer friendly.
Yeah, and I think you really hit the nail on the head, that the brokers are not just selling a plan. They're trying to serve as a partner to their employers and the employees and build the best plan out there. And you mentioned earlier to me that you're hearing a lot about the Consolidated Appropriations Act?
Consolidated Appropriations Act,
so,
yes.
I know nothing about that. Talk to me a little bit about it.
So the Consolidated Appropriations Act was passed in 2020 or 2021, somewhere like right around then. One of the brokers in one of the sessions yesterday said that it has more healthcare language in it than the actual ACA bill.
Oh, wow.
So that's something we're just seeing the tip of the iceberg right now. One of the things we've been hearing about is mental health parity enforcement, and that was part of the Consolidated Appropriations Act. But the brokers themselves are really still delving into all the language in there. There's going to be a lot of regulations coming down that's really trying to open up healthcare and make it more accessible to consumers, make it more transparent. One thing we're hearing is that employers will be increasingly looked to as fiduciaries. Do you know fiduciaries? It means that when they're doing their healthcare plan, when they're doing their benefits plan, they need to show that they are acting in their employees' best interest.
Right.
So they are taking their employees' money for healthcare premiums, for all of these things. So they need to be showing that they are getting the products that are offering the most ROI to their employees. And I think there's a lot of language in the Consolidated Appropriations Act that is really just going to put employers and their plan partners, all of the vendors, all of these healthcare providers on the hook for showing that they are acting in the consumer's best interest. And so I don't know how much is in the Consolidated Appropriations Act, but from what I've been hearing from the brokers, it should be interesting to see how that changes the industry.
That's a lot, and as you're talking about this, and we're very, very focused on ICRA, which in essence kind of takes some of that onus off of the employer, and to me this is just one more step towards that the employer is like, I'm giving you dollars because Joe's Pizza's expertise is not in healthcare. How can they be able to build that whole plan? But to say, look, I'm giving you dollars and you can now go and look at these plans and find what works best for you. I think what I'm hearing you say from this Consolidated Appropriations Act and the fiduciary responsibility and this idea of putting healthcare into the employee's hands may all come and tie together, and we'll start to see a huge increase in the ICRA world. That's my hypothesis. We'll have to see.
So my only caveat there is that we really need to consider the full range of the population. I have been fortunate the last 4 or 5 years to be learning about healthcare, health insurance all day, every day. And so I feel like a somewhat empowered consumer to be able to go out there and pick the health plan, pick the providers, pick the procedures that are best for me, know what I need to do. Not everyone has that luxury. If you're an American working 2 jobs, 8 hours a week, taking care of a family, you gotta get dinner on the table, help the kids with homework. You don't have time to learn about healthcare.
Oh, 100%.
So, I mean, if we can collectively increase the knowledge around healthcare and empower consumers who have that time, I think as a result we'll see changes that benefit everybody. So we're going to need that part of the population that can advocate for change to go out and be advocates for change. But we also have to remember all those other people who just don't have the time, the resources,
or the expertise, and that's really a lot of that is where the brokers come into play. 73% of the entire population that enrolled in ACA this past open enrollment were broker assisted. Because as much as we like to say it's consumerism and you can just go and do it, it is a complex process, and you're absolutely right. People like you and I live and breathe this every day, but one of the reasons we do this podcast is so that we can distill all of the wonky talk that we're using on a daily basis to dinner table conversation, because it does affect everyone and we need to find a way to make it accessible to everyone.
Definitely.
Awesome. Well, thank you so much for joining us. This was so fun. I'm sure you're exhausted from the prep up till today and all of today. And we would love to have you back. Maybe we can delve more into the Appropriations Act. And see where
I will start studying up. I will read the act cover to cover.
There you go. See, you're the person who reads it cover to cover, and then we can distill it to high level topics.
Yeah,
we'd love that.
So I'm going to need about a year to get through it all.
Well, it's great to have you. Thank you so much.
Thank you for having me.